Okay, so first I'm gonna go ahead and check the orders. I'm gonna see that it is Robert Crowley and that he needs to receive blood because his hemoglobin level is at a 6, which is below the threshold for normal. And then I'm going to look up and see if he has a consent form sign, and it looks like he does. And then I'm gonna go and see if there's a cross match done within the last 72 hours. Looks like he got that done today, earlier today, and he is B positive blood. So I will keep that in mind and keep that order open. And then, yeah, the provider's order says to administer blood right now over the span of 2 hours due to his hemoglobin being low. Okay, awesome. So I did all my checks, and I'm just gonna gather some supplies. So I'm gonna get my NS, normal saline. I'm gonna get my B positive blood. And again, I'm just gonna check with here that the cross match is B positive, Robert Crowley. I'm gonna grab my tubing set, and then I'm gonna grab my flush right here, so I can flush the line. Okay, all right, I'm gonna go ahead and go into the patient room. Hi, Robert. How are you?
Pretty good. How are you?
I'm good. I'm Allison. I'm going to be your nurse today. Is it okay if I get your name and your date of birth?
Yeah, Robert Crowley, 1221.
Okay, perfect. I just checked the orders, and it looks like we've got to administer blood to you. The reason being your hemoglobin or your the blood oxygen level in your body is below the threshold of normal. So it's at a 6, and we want it up to that threshold, okay? Do you have any questions about why you're getting blood?
No, I think it sounds good.
Okay, awesome. So I'll just walk you through the process. I'm gonna go ahead and flush your IV real quick, make sure that that's okay. I'm gonna set up all my tubing and stuff, and I'm going to get a second nurse in here to verify everything. Actually, before I set up my tubing, I'll have the second nurse come in and verify everything with me. We just want to make sure that we're administering the same blood type, and we've done the cross match earlier this morning, and it looks like you're B positive. Is it okay if we get started with that? Do I have your consent to begin?
Yeah, sounds good.
Okay, awesome. All right, so I'm going to go ahead and do hand hygiene and grab some gloves on while I'm dealing with this blood. And first, I'm going to go ahead and flush your IV. Make sure that everything's working. So I'm going to inspect the area. It doesn't look like there's any redness or swelling. Has this been hurting you?
No.
Okay, perfect. I'm going to scrub the head for 15 seconds. We'll just simulate that. Okay, and then unclamp it. Flush it, and looks like that's flushing nice and good. Okay, and then in the meantime, I'll put on this alcohol cap. Let that sit for a minute. Okay, now I'm gonna have another nurse come in and verify all the orders with me. Actually, before that, I'm gonna get a set of vitals. So got the vitals, just simulated that, and I'll chart them, and they all look normal, including the temperature. Now I'm gonna get my second nurse to come in and verify everything with me. So first I'm gonna go ahead and tilt the bag, make sure that there's no clots in it. It doesn't look like a purplish color, it looks like a normal color, and everything looks good. And then I'm gonna go ahead and check the expiration date, 12/3, that looks good. And then I'm gonna go ahead and do another cross match. So I've got B positive on here, and there's B positive right here, which is what Robert Crowley's cross match is. Okay. Now we'll go over here, and I'm I'm just going to do the bag to the tag first. So if you want to just, or actually the patient to the bag or the tag. So if you want to read right here, or I'll read right here, and if you want to look at that, I've got Robert Crowley. His birthday is 12/21. His MRN is 8154485.
Looks good.
Okay, awesome. And then we'll do the bag to the tag. So I'll go ahead and read this unit number if you want to look right there. D947 D9B7B6 BE1 F2A6E.
Yeah, looks good.
Okay, awesome. So we've got all of that. Again, I verified that the expiration date was good. It's packed red blood cells, which is what the order is, and everything's correct. So I'm gonna go ahead and have my second nurse sign with me this form, saying that we checked it all off. Okay, perfect. Alrighty. Now I'm gonna go ahead and prime my tubing with my NS. Make sure the blood part of the tubing is clamped. And I'm going to clamp this part as well. Okay, and then with this, I'm going to spike it. I'm just going to squeeze this. Make sure that the fluid comes above the filter line. Perfect. Alrighty. I'm just going to prime all of this. Perfect. I'm going to clamp this line with the saline, and then I'm going to go ahead and just hook this right here. If I can. Okay, maybe not. I'll put this up here. Okay. Now I'm going to take my blood, do the same thing. I'm going to unclamp this one now. Spike the bag. Oh. That spike wasn't very good. It's kind of drippy. Sorry about that.
Mine gave me a little trouble too.
Okay. No, it's not really in there all the way. Okay. If this was real life, I would go and get a new blood bag and start all over again. But just for the simulation purposes, I'm just going to go ahead and spike that nice and good. Okay. Well, not as spiked as well as we can. Okay. have the blood hit right there. Okay, now I'll prime this with blood, making sure not to lose any of my blood. There we go. And I'm going to go ahead and put this into the tubing. System on it. Okay. Alrighty. So I'm just going to program it really quickly. We're going to do channel select, guardrail IV. I'm going to go down to blood, packed red blood cells. Yes. And then for the first 15 minutes, I'm just going to go at a rate of 1 milliliter per minute, which is going to be 60 milliliters per hour. And then there's 500 milliliters in here, so I'm just going to put 490. And then I'm not going to start it quite yet. I'm just going to talk to the patient for a minute. So before I hook you up and start this infusion, I just wanted to kind of go over signs and symptoms of an allergic reaction or transfusion reaction, just so that you're aware and you can let me know if you're feeling any of these things. So please let me know if you're feeling any fever, any rash, any hives, along the area of insertion or just anywhere in your body, or if you're feeling like muscle weakness or like cramping or soreness. Those are all signs of maybe a transfusion reaction. I'm going to wait in the room with you for the first 15 minutes to just make sure that this, if this does happen, I can stop the blood and we can, flush it, or not flush it, but give you something to reverse those effects. But please let me know if that happens, and I will be getting your vital signs after 5 minutes and then after 15 minutes, just to make sure that that is not the case as well. Do you have any questions about that? Questions for me?
I think that all sounds good.
Okay, awesome. All right, then I'm gonna go ahead and hook you up. I'm gonna scrub this guy. Since we've got an alcohol cap on here. I'm gonna make sure everything's unclamped. And I'm gonna press start. Okay, now we're gonna wait in the room for 15 minutes. So I'm gonna simulate it. It has been 5 minutes, I'm gonna get the vitals. Now it's been 15 minutes, I'm gonna get the vitals, and everything looks good, including the temperature has not changed. So this patient seems like they are not having a reaction. So I'm gonna go ahead and come over here. I'm gonna channel select, and I'm going to increase the rate to 250 so that it's administered within 2 hours. And then I'm gonna go ahead and start that. Okay. All right, how are you feeling, Robert?
Feeling pretty good. Yeah, none of those signs that you told me about. So.
Okay, perfect. Well, you let me know if you are feeling any funny way. And just also let me know if you need anything else. I'll make sure that you're safe. So I'll put down the bed all the way down, 2 side rails up, locked bed, and the patient has his call light, hand hygiene. And then I'm gonna go ahead and document that the patient had no reactions and that I administered the blood.